Hey guys, what's up? And as the title of the video says, it's 15 days total hip replacement. The first 15 days, and this is going to be a video on exactly that. The first 15 days. I'm 62 years old. My hip was my right hip was bone on bone, and I was dealing with it for a long time. And I was unable to do a lot of stuff. I was limited in my range of motion was limited. I couldn't run. I couldn't do anything that I wanted to do. I couldn't put on my socks. I had to get in a really weird position to put my sock on the one side, the right side. Um, and I really got sick of people saying, "Hey, what happened to your leg?" or "What'd you do?" You know. And so I finally decided. And by the way, I'm 62. It was my first surgery in my whole entire life, and so I decided to do it. I did my research. I got a good surgeon at Royal Oak Beaumont Hospital, and here in Michigan. And what an amazing experience. And not a whole lot of people can say that about surgery, but I'm saying it to you. If you're holding off, if you're not sure, you need to do it, because if it's affecting your quality of life, then you need to do it. So anyway, this is day 15 is today. Post right hip replacement surgery. So let me rewind the clock, and we'll take you back to day 1. Oh boy, it's surgery time. December 2nd, I'm here at Beaumont Royal Oak. I'm getting my right hip replaced, and this is it. I'm finally doing it, so we'll see you on the other side. So, the first day, day 1, surgery. I had so much anxiety, and the doctor told me, he was very reassuring. He said, "Look, number one, we're going to give you something to relieve your stress, your anxiety, your high blood pressure, whatever you have. They'll do that." So that's what I did. That's what they did. Is when I was in the surgery in the pre-staging area, they gave me a little something to relax me, which was great. And that point on, my surgeon came in and said, "Look, you're really low risk." It was a same-day surgery. And I say that because he reassured me that, you're going to be in and out of there the same day. And I was in surgery at 8 a.m. and I was home by 6 that night. So it is a same-day surgery. The scar is maybe 4 inches on my hip. 4 inches is really good. I mean, as compared to some other, operations that I've heard of that maybe 6 to 7 inches. But also, I want to get into posterior versus anterior. My surgeon did posterior. And you hear a lot of talk about, the new way to do it is anterior, because it's a lot less pain and a lot less recovery time and this and that. I'm here to tell you, it really doesn't make a difference. If your surgeon is good and and it's all dependent on the person. If you recover well from things, as I did, then it's not going to matter. Day 15, I've got posterior hip replacement, right side, and I am walking maybe almost 3 miles a day. So, there's no real. And also, I want to say another thing. The anterior hip replacement, there is a risk that they can cut into nerves on your in the front part there. That's what my surgeon said, and that's what I hear from a lot of other guys that got the anterior approach. They said, "Look, oh yeah, I got some numbness in my thigh." Oh, okay, well maybe that's the anterior approach versus posterior. But so here we are, day 15, and I was going through my surgery day, and so they gave me something to relax me. And my doctor got me, he's like, "Look, I really recommend that you do a spinal anesthesia. Because a spinal anesthesia, they do not intubate you, they don't put a tube in your nose, nothing like that. If you can breathe, if you don't have any breathing issues, you're fine to get an anesthesia in your anesthesia through the spine, and it's much better because they say that there's not a lot of nausea associated with it or anything like that." So I took the spinal anesthesia, got in the operating room. I was looking around, and there was all the operating equipment and the tech that goes along with the surgery, and they didn't even give me a countdown. Before I knew it, I was out. And I woke up, and I tell you, I woke up feeling amazing. All right, just a quick note. So I came out, and I was just amazed how fast it went. I was laying on my side 1 minute, and then boom, I'm in the recovery room. I can't feel my leg right now. Because they did the right hip. I can't feel my leg because they did a spinal epidural, I guess it's called. And I feel fantastic. It was amazing. I was shocked how fast it went, and I don't know. Anyway, I'm just waiting for my leg to get back to not being numb, and I'm waiting to walk. That's what I really want to do. So, all right, I'll check back. I laid there for a couple hours. They made sure that I could go to the bathroom and I could do all these other things. I walked. They get you right up and they walk you. So, a couple hours went by. I walked around the hospital floor. There was really no pain, and my doctor came in and he's like, I was like, "Doc, this is great. There's no pain, man." And he goes, "Yeah, they call this the honeymoon." I go, "What do you mean?" He goes, "Well, we gave you enough nerve block and pain medication, so you're not gonna feel it for a couple days." I'm like, "Okay, well, I can deal with that." So they sent me home 6 o'clock with meloxicam, with aspirin, with tramadol, and with oxycodone, which I really didn't even want to use, and I didn't end up needing to use at all. So I got home that night at 6 o'clock. I kept taking the Tylenol Extra Strength, never ended up taking the oxycodone, never ended up taking the tramadol. I followed the other instructions, took all the other drugs that I was given, the aspirin and things like that. So that was day one, or no, that was a surgery day. And let's move to day one. So I woke up, and obviously it was very tight in that area. It was stiff, but the more that I moved, the less pain and less tightness there was. So I made it a point, move every day. Every day. The pain level at day one never got above a 4. So day 2 comes around, and there's still not much pain. I was like, okay, well, maybe the big one's on day 3. Pain level was still at maybe a level or a 3 or a 4, I want to say. Never got above that. Never had to reach for those narcotics at all. And in the meantime, always keep moving, keep moving, keep moving, keep moving. And day 3 came around. By the way, I was sent home with a walker and a cane. I used the walker one day on day 4 when I was walking a lot, and I could definitely feel a little bit of like soreness in the area. Not bad. But so anyway, day 3 came, and in around the house, never used the cane, never used the walker. I walked back and forth, back and forth, back and forth. Hey everybody, it is day number 3 after hip replacement surgery on the right side. Some of you may know I was limping. I was favoring the left side. I was walking more to my left side because my right side was kind of, my hip was actually bone on bone. So great team at Beaumont Royal Oak. It was amazing how they got me in and out, and they got me walking really quick. And basically, pain level has never exceeded 3 or 4 at this point, and it's 3 days later, so that's a good thing. I haven't tapped into the heavy duty pain medicine at all, and here's me walking right now. Okay, we're gonna go like this. And as you can see, I don't need a cane. I don't need a walker. Everything's good. Thank you, everybody. Never any pain. And I was like, well, when is this big pain day coming? When am I going to feel it? I'm telling you, it's day 15. Through the whole entire experience, never got above a 4. And so, day 5 comes, and I'm doing stairs. I'm like, you know what? I'm doing the exercises they told me. I'm doing everything they told me. I'm going to try stairs. So, they teach you to walk down with your bad leg and up with your good leg. So I was like, okay, I'm going to try walking up and down the normal way. And I was able to do that. Hey, everybody. It is day number 5, post-hip replacement surgery, right side. I'd show you the scar, but I don't think you want to see it. Anyway, every day, feeling better. Mobility, range of motion. I'm doing my exercises. The pain is nowhere near what I expected. It's maybe a 2 or a 3 at this point. I can get in and out of bed. I can walk. Not very long distance, but I can walk pretty far without, getting sore or whatever. But right now, I'm going to go up the steps right now. I'll show you how I go up the steps. Here we go. Day number 5. Stay tuned. Thank you, everybody, for your support. No problems, no pain. Day 6 through day 9, pretty much the same. I tried to walk more and more and more, and every time I walked, I'd feel a little swelling going on. But every time I walked, it took the swelling down, and it would decreased the swelling majorly. I iced everything. Every day I would ice the side of my hip, and I would ice my leg. Very important. Day number 10, I did get some swelling in my leg, in my calf, in my knee, behind, and they did say that, listen, you're going to have some swelling if you're doing all that walking. So, I did get a lot of swelling. I kind of thought in my head, oh, is this like a blood clot, or is it something like that? No, it was just some thigh or some knee and some calf swelling. So it went on for a few days after that. And by the way, every day I'm walking 2 and 3 miles. Even on day 13, I got on my elliptical and I was doing elliptical exercises. Not major, but I did hang in there for a good 5-10 minutes with on the elliptical. So here it is, day 15. No pain, absolutely no pain. The swelling has gone down drastically. And I'm here to tell you, if you're thinking about getting hip surgery, if you're on the fence, if it's your first time, if it's your first surgery, you need to just do it. Because I'm telling you, you're going to get your life back. You will, you'll spend maybe a few months with the muscle recovery and maybe a few months getting back to your original range of motion, things you could do before, even running or kneeling or stooping or, things like that. But I'm here to say, you need to just do it. Anyway, that's my story. Day 1 through day 15. Hip replacement surgery. It's a breeze. All right, y'all. It is 30 days after right hip replacement surgery. On the elliptical, back at it. Feeling great. Just thought I'd let you know. 30 days. Taking it easy, but I'm back. All right, y'all. Here we are. Just shy of 2 months after total right hip replacement. At the gym, back at it every other day. Feeling good. I'm gonna keep going, because that's what I do.